Dr. Leisle, it looks like many parents ask themselves a question of, do I still need to go to a normal dentist or to a child dentist while my child is undergoing orthodontic work with an orthodontist? Because after all, during orthodontic work, on an average, you see your doctor, your orthodontist about give or take once a month. So, why would I fit in another visit every 6 or whatever months for the dentist? Can you shed some light on it?
Sure. Yeah, that is a question that comes up once in a while. I have sometimes parents that come by, they forget, they get their recall card or they don't get their recall card, and they go, why do I need to go to you? And when I'm going to the orthodontist all the time, like you said. It's important to go to the dentist, your regular either pediatric dentist or your regular dentist on a regular basis, because the orthodontist is not looking for cavities. The orthodontist isn't really looking for gum disease and other problems in the mouth. They're strictly involved in the movement of the teeth and how your facial structure is looking at. But I know it seems like, gee, I'm going to the dentist all the time. I'm going once a month. Or if you have two kids going to the orthodontist, they're going opposite times. But it is needed because there is diagnosis that the orthodontist is not looking for that is needed at the pediatric dentist or children's dentist that the orthodontist is not going to take care of. And he's not taking the x-rays that are needed between the teeth to find those problems that the regular dentist will find for you. So, yes, it's very much needed to have, even if it seems like maybe you're going to the dentist all the time, you're going for two different reasons, not to straighten the teeth, but for oral health, make sure you're still on track.
And I've heard that when a person wears braces, that of course the maintenance and dental hygiene is much more difficult and much more prone to create problems than if you don't have braces.
Yes, the braces are like food magnet. Food just going to pack around those puppies. And so what we recommend is an ultrasonic toothbrush for that kind of thing. And a lot of times the orthodontist suggests that too. But yes, it's very important. They're going to be more prone to having problems. The other challenge is that the kids that go to the orthodontist, they think they're supposed to be just brushing their teeth twice a day like they do them before, or 3 times a day. In my office, before a child, I refer a child to the orthodontist. I suggest that to the parent that the child is at least brushing their teeth 3 times a day before they go to the orthodontist. If a child's not willing to brush their teeth 3 times a day before they go to the orthodontist, they're not going to be willing to brush every time food goes in their mouth, which could be 5-6 times a day when you're a teenager, when they have braces on. And if they're not willing to brush their teeth every time food goes in their mouth, snacks, meals, all that, they're going to have white stains in those teeth when they come out of the braces. Or they're going to have straight, striped teeth. And the parent didn't pay $5,000-6,000